Okay, so guess what? I got your back. All right. So that's what we're going to talk about. I got your back. All right. Do they really have your back? Do you even understand what your back is for? How many people understand that your back is not meant to pick up your grandchildren? How many people understand that your back is not meant to get you off the toilet? How many people understand that your back is not meant to make love? Your abdomen is. How many people understand that when your core is on the floor, so is your immune system? How many people understand that the tone in your abdominal muscles is the most important tone of all? Hey, you know what? I go to the gym all the time and I work out, man. You want to see these pipes? Look at these pipes. Let me tell you something. More important that you could ever understand is when you're young, you can get it done. Okay. But when you get to the age of 30, it gets down and dirty. You got to understand this. There is no more important muscle group in your life. You need to get this than your abdominal muscles. Last night, we watched a show on YouTube, and it was on for about an hour and a half. And what did I do? I did my pelvic, some of my pelvic work. I did lots of different techniques of sit-ups in bed, and they're not what you think. They're little things I created. I also did my crab stretch, but I did like about over an hour workout, just laying back in bed, watching something, because guess what? I'm going to utilize my time and stay young and get it done. But I want to tell you something. Why don't you take a look at the majority of the population? And when I come on here, everyone, just understand something. When you tell the truth today, you know, people go, oh, is he angry? Oh, why is he so upset? Why is he judging us? Why is he picking on us? Well, the reality is I'm not. We get used to looking at people, okay, as a norm. How many people out there believe that they're not a statistic? Well, you are a statistic unless you're going to do something different than the majority of the population. And remember something, they do call it the majority of the population. I started off yesterday and I lost the internet, but today I'm going to be playing an audio for you. One of my clients' patients in New York went to see the top spinal surgeon in New York because only the best will do for her, and I get it. I'm going to play something for you, and he is not lying, but guess what? He doesn't know what he's talking about. So did you ever have someone say to you, like a doctor or a surgeon, I'll keep an eye on that for you? What are they going to do? Are they going to live behind the toilet, under your bed, or in your closet? All right? And understand something. We're going to talk about some things that just aren't true, that are built on BS, dysfunctional belief systems out there. Let me tell you something. You know, when I first got out of school, I became a registered massage therapist, and it only took me 6 months before I wanted nothing to do with it. Because massage therapy doesn't get to the point, because your hands don't feel anything. They don't feel the knots, the crystallization, the calcification. They don't feel the little fibroids or the little tumors or the cysts, where your elbow does. And that's why I came up with Wolf Non-Surgical. But let me just tell you something right now. Here's the deal. Your abdominal muscles are the important muscles of your body. If you were to have a very strong and toned abdomen, you know, people say, I've got a 6-pack. Well, you don't need a 6-pack. Just get a 1-pack, for gosh sakes. That, you know, you want to have that this is toned. It's not hanging down. How much can you should not be able to pinch more than an inch. Your abdomen should not be sticking out further than your nipples. Do you get that? Whether you're a man or a woman, or you're in big trouble. Now, just so you know, okay, 40 to 60% of the population is overweight or obese. Okay, all right. Actually, it's up to 80% now. 80% of the population is overweight. 40 to 60% is obese. And obesity is actually more than 10 pounds overweight, not 40. They changed it for everyone so you could feel more comfortable about all those fat cells that you're creating to store all that inflammation and infection. Now let's talk about the back. So a lot of people, their back is really tight. Their back goes out all the time. Well, your back doesn't go out. Your back, what happens is your back has to pick up for the slack. your back has to pick up for the slack that your abdomen is in. Understand something, everyone. If your belly's sticking out like you ate a beach ball, then that means that you have your own little private manure pile in there and it's rotting. That's right. The manure is not just rotting, but you have tissue rotting. I'm going to tell you something. When you find yourself getting bruised, but you don't even bang into anything, you're the walking dead. You heard what I told you, didn't you? You're the walking dead. Because here's the deal. That means that you actually, if I could open up that part of your body that just bruised, you never banged into anything, it would actually smell like rotting flesh. I'm not kidding. And understand something. It's not normal for you to smell under your armpits. It's not normal to smell your groin. It's not normal for your poo to stink up the whole bathroom. So understand something. So we get rotten to the core, okay? And then our core falls on the floor. So people that stick out straight, that's gas. You've got your own manure pile, so you're gassing up, and that's, you'll have a lot of heartburn, you'll have heart pressure, you'll have trouble breathing, and that's because hot air rises, and that's why you have bad breath. We don't actually have gum problems. We actually have bum problems, okay? We don't actually have gum problems. We have bum problems because hot air rises. But let me get back to what I want to talk about today. You got to hang in here, guys. Hang in here to listen to this video because it's going to be really important, okay? And I mean it's going to be really important. You watch this. So here's the deal. So now let's say that my abdomen is starting to fall down and out. Well, that means that your large intestine, the transverse colon, has fallen down. That means your small intestine is falling out and down. And that means that you are crushing your prostate. And that's why prostatitis has gone up, okay, 40% in the last 5 years. And they said it'll go up 500% by 2030. Well, that's because guess what? We're eating ourselves to death because 90% of the food we eat didn't exist 90 years ago, and neither did 90% of all these autoimmune diseases, which means that your body's attacking itself because you're attacking yourself because you didn't make a conscious, educated, logical decision on what you put in your mouth because you only had 4 inches of consciousness. Do you understand? I'll make it fit. You know, who cares what it is? Do you ever ask yourself, will this bring life into my body? Because everything you eat is all about the light and all about the frequency. I mean, that's really what it's about. You can turn cancer on or turn it off. You can turn a person on or you can turn them off. So here's the deal. So now your abdomen is softer and softer, which means your back is going to get harder and harder. So your back is going to start contracting. But how many people here know that I would say this, the Royal Society of Medicine said that 85% of the population, okay, gets all their diseases, which there are no diseases, just symptoms that turn into really bad symptoms because you get really bad information and therapy. Yeah. The majority of natural health therapy does not work out there. And the medical system is for emergency care. So you might want to think about that one too. But here's the reality, and just so you understand this, the actual fortitude, the actual strength of your large intestine is going to determine what your life is going to be like, whether it's a bumpy road, okay? And understand, everybody, if you could just, I promise I won't leave if you want to hang in here. But the reality is I'm going to answer every question. Please do not come on with any questions till I play this audio. So now what happens is that your large intestine's falling down on top of your small intestine. And remember, your intestines are a muscle like a snake. And now it's laying inside of you limp and it's pushing down on where? Into your pelvic girdle. And if you don't have any tone, then your large intestine, mainly your large intestine, is like a screen door in a submarine and you're pooping in your pelvis. Now, whether you want to believe this or not, does anybody know what is the major surgery that's done today? The major one. Well, we know it's cesareans. Well, we know that women need cesareans because they're pooping in their pelvis. We know they don't eat right. We know they get uptight. We know that they get infected, inflamed. They create scar tissue. And we know that they get contracted and then they can't open up properly. Okay, think about it. But let's talk about this. The second most important surgery, not most important, but done, is actually the low back. Okay, and the hips. And I'm going to tell you, the low back surgery, it's gone way through the roof. And the hip surgery's gone way through the roof because you've been pooping in your pelvis. And yeah, you can't move your hips like Elvis, can you? Okay, so there's the problem right there. Okay, is that we are pooping in our own bodies. So what happens is infection goes to inflammation, which goes to scar tissue formation. But as far as your abdominal cavity goes, you lose all the tone and everything just lays in there limp. Okay, so now what happens is the large intestine that used to be your major plumbing, it used to be what? Your compost. It was 85% of your immune system. It is now not a good circulatory plumbing system. It is a swamp. So what came first, the swamp or the mosquito? So why do you think you have infection? Well, come on, a swamp, right? And that's what you become. Now, we're going to go back to the back. So did you know that your spine is not meant to pick things up or to pick you up or to get you off the toilet, get you out of the car, to pick your children up? Or no, it's your abdominal muscles that do that. Your back, your spine, it will hold you up straight. That's what it's meant to do. But it's meant to house the actual what? Spinal fluid. So your spinal fluid goes up to your brain and then back down to your pelvis to the tip of your coccyx. And what happens is it's picking up information from the pelvis mainly and the rest of the body and then sending it to the brain and telling the brain what hormones, what chemicals to send in other parts of your body to actually heal you. So the reality is, think about this. Chiropractors are right. You don't want a crooked spine. Okay, you don't want a spine where the discs are starting to thin out. They're actually not thinning out. Did everybody know that? You're not actually losing fiber from your discs that are in between your vertebrae. That actually what's happening is you were pooping in your pelvis. That created the infection, which then created the inflammation. Do you actually think that when you make your abdomen has no tone and you start to become toxic, it's not going to affect your low back and your kidneys? Listen, I'll tell you right now, 95% of all low back problems, okay, and all kidney problems and all hip problems, okay, and are actually caused because of a dysfunctional large intestine, because of the lack of tone in the intestinal muscle, the large intestine, and the abdomen. Okay, so I want you to really get it. It's called logic. If you don't believe me, go to my library at docofdetox.com and watch The Highway to Health. And also go watch Holy Crap, Your Large Intestine, the Holy Grail. And then I want you to call me and then test me. Because guess what? You watch these two videos and you'll have more health education than you got even if you went all the way through university. Did you hear what I just said? You'll have more health education there because we need to become logical. And everything I'm talking about here is logic. And if you can't wrap your head around it, I get it. But go watch also Reverse the Irreversible in my library at docofdetox.com. I don't mind being challenged, but I want to be challenged by people that aren't bullies. I want to be challenged by people who are actually challenged themselves because you know that you deserve a better life. Now, so here we go. We lose muscle in our intestines, and we also lose muscle in the abdominal muscles. We lose tone, and guess what? Now your back gets really tight. So it gets contracted because it has to pick up the slack. Now, I also told you there are discs in between every vertebrae. You do not lose the cartilage that those discs are made out of. What happens is from infection, it goes to inflammation, and you're actually inflaming those discs that are in between your vertebrae, and they're dehydrating. That's right. You're losing the actual blood flow. There's blood flow there. You're losing the water. Of course there's water, and you're losing that and it's dehydrating. So it looks like they're thinning and you're losing the disc, but you're not. I'm going to tell you something right now. The average person loses anywhere from 1 inch to 2 inches of height by the time they're around 40, 50 years old. I will tell you that if you were to get a non-surgical, Wolf non-surgical spinal treatment, and in 1 hour to an hour and a half, we will have you back almost to your normal height that you were when you were in your 20s. You heard what I just said. So that means that I'm right. So it's one thing to say something, Dr. Wolf, but you better back it up. And I will back up everything that I say. You may not like what I say, or you might think that, oh my God, who does he think he is? But it's logical. I just want to bring you logic. You deserve to be healthy, don't you? So don't let unhealthy beliefs stop the things that I'm trying to teach you. Now, so we're going to get in there. And if we were to go in between every vertebrae and we were to use Wolf non-surgical, our elbow, we could actually bring back the blood flow, lymph flow, and then that would become a nice soft cushion again, and you'd have your height back. You know what doctors say? I really love this. Don't you love this part? Guess what? What? Well, you've lost about 2 inches of height, and that's bone calcium. It is not. What do you think? Your skull got smaller or your legs got shorter bone-wise? I don't know. You know, people in the health business need to be logical and understand something. The longer you go to school, any government regulated school, you're going to be indoctrinated. What do you think they call that for? So now here's the deal. Let's keep going, everybody. Let's keep going. Okay. So everybody knows this, right? You've got your sacrum, which is at the very bottom, okay, of your spine. On either side, just an inch and a half away, put your hands down there and you'll feel these bumps. That's called the SI joints. Now, what happens with everyone when you say, I go to the chiropractor once a week or once every 2 weeks because I have him to put my back in place because it comes out of place. No, it doesn't. You've got scar tissue and crystallization and calcification wrapped around the 2 SI joints. And when he pushes it back into place, it's going to come out at the first red light. If we were to go in with Wolf non-surgical and clean around those SI joints, it's not coming back out. It's the scar tissue in there. Do you know why people have sciatica? Do you know why they can't put their foot on the ground, why they drag their leg? Because that SI joint has scar tissue around it. Okay, so here's what happens. When it gets scar tissue and calcium around those SI joints, you waddle like a duck because you're supposed to move like this, right? See, this is how your hips are supposed to move, like this. So when you get scar tissue and calcification here, I just love that. Somebody just said, I have a love-hate relationship with you. You know what? I got to tell you something. We have been so programmed that if the truth comes up against our beliefs, or if the truth comes up against that we need to make a change in our lifestyle or in our personality, people hate me. I mean, wow, I didn't have that 20 years ago. Now, everybody's a victim. Everybody gets hurt. I'm just going to try to ignore things here. And I'm only going to try to look at the things where people are asking me questions and not coming at me. So now those SI joints get frozen from scar tissue and calcium. So women, you ever see them? They waddle like a duck. That doesn't look like their bum is chewing bubble gum anymore, does it? Or guess what? They work like this, like peg legs. Okay. They can't move anymore because the whole bottom area, the sacrum, the coccyx, and L1, L2, L3, L4, and L5 are now frozen because of the SI joints first, and then the sacrum. And understand this. And then those discs are not thinning out. They're getting dehydrated like beef jerky. Guys, if you go and buy beef jerky would be about maybe 1/8 to 1/4 inch thick. Did you know that that was 1 inch to 1.5 inches thick of muscle? The same muscle that beef jerky is made out of, whether it's from pork or from beef, you have the same muscles that a cow or a pig does. And understand, you didn't get it made into beef jerky on purpose, but you did it with your mind because it's a landmine. You made bad choices. You didn't realize that you're pooping 3 times a day and making sure that you detoxify your liver and you get on a perfect day every day, then you'd have perfect health. You know, all of us were programmed that until we're broken, we don't think about our health. That's why we're always running like a 911 emergency to the doctor. And because we know nothing about our health and understand this, and now I'm going to get beat up again about this, okay, is that I would say about 90% of natural health practitioners don't understand health either, or what I'm even saying here. And understand something, it's all about displaced calcium. It's all about scar tissue in your body. What scar tissue? I never had an accident. I didn't have a sports injury. No, it's from the infection that created the inflammation that caused the scar tissue formation. You wouldn't be getting your hip surgery, your knee surgery, your back surgery, or your shoulder surgery, your wrist surgery, or any other surgery if you knew how to get rid of inflammation, because there's only one disease, and that's inflammation. There are no diseases. There are just symptoms that get worse because we have such sucky therapy out there and treatments. And because here's the deal. If you want to come to me for treatments for the rest of your life, I won't allow it anymore. You need to come and get treated, but get trained on how to run that beautiful body of yours. That's what you need to understand. So I'm going to tell you something right now. Whether you're talking about scoliosis or kyphosis, you're talking about having to get a rod put in your back, you're talking about spinal fusion. Okay, you don't have, okay, I'm telling you right now that 95% of all these surgeries never had to get done. Oh, I'm going to go see a surgeon and see what he's got to say. Well, a surgeon's going to say this: take these painkillers, we'll keep an eye on it. And he's going to keep an eye on it. Well, it's not going to get better. If you don't change your personality, you're not going to change reality. If you don't bring down the infectious, inflammatory foods that you eat and the way you think, then why is it going to get better? It's just a matter of time that there's going to be enough scar tissue and displaced calcium that he's going to have to, or she's going to have to go in there and do surgery. That's the bottom line. Look at, I'm going to tell you this. You don't have to come to us, but I've taught over 1,500 non-surgical body workers, Wolf non-surgical body workers. Go to them. They'll give you a money back guarantee because I guarantee their work. When you do Wolf non-surgical, we guarantee that with the first treatment, if you have to go to surgery, we're going to refund your money. We're going to do one treatment on you, and we're going to prove to you that you don't have to go to surgery, and that if you were to actually change your personality, change your reality, and get on a high vibrational diet, okay, and detoxify properly, okay, of the parasites, yes, and the heavy metals. Understand something, and somebody's asking this question. My black diamond, okay, and my black gold will get rid of all the heavy metals and the parasites in the human body. Do your research. And we do a little bit of that every day because guess what? You want to create a perfect day and just do a little bit of these things every day. Why would you let yourself blow up? I just love how people go, you know what? You know what I do? No, what do you do? Well, every 6 to 9 months, I do a really deep cleanse. Why? Well, because I feel like crap. And then what do? Well, then I go back to the way I was. No, if we could get people to do a perfect day consult and we could teach them that if they did 80% of what we asked, they're never going to get themselves in trouble. So let's understand something. It's a scar tissue issue. I'm going to play something for you right now. Okay, here we go. Now, this is one of my patients, okay, clients, and she went to the top surgeon in New York, okay, and she taped this. Now I'm going to stop it and start it, and I'm going to understand. I want you to understand something. We need surgeons. We need medical doctors, but they're for emergency care. We need natural health practitioners, but they are to teach us how to become our own practitioner. We don't need natural health practitioners to go to treatments with them all the time, because that means you're only good until your next treatment. And that's the deal. Okay, so here we go. And after I do and play this, then you can come on and start asking questions. Okay, all right. And when you come on and ask the questions, bring them on slowly, and I will go through all of the questions and answer them the best I can. Okay? All right, let me just do this. Let me get this keyed up. So let's make something very clear. It's issues in your tissues, and it's junk in your joints. And we can get rid of the junk in the joints, otherwise the calcification, and put it back into the bone. I hope you know that you know, when you get osteopenia, osteoporosis, arthritis, you're losing bone calcium. That bone calcium isn't leaving your body. That bone calcium is calcifying your joints and your tissues and even your brain and other organs. Okay, when somebody says, I've got gallstones, just know this, that those are calcium and cholesterol. Cholesterol is being made, a lot of it, because you're so acidic, and the calcium because you're so acidic, and you could get yourself into big danger. When you've got gallstones, that's what they would call cancerous state, because you're having to pull so much calcium from your bones to buffer down the acidity, because you could go into such inflammation that you could reduce the oxygen in your cells by 35%. And Dr. Otto Warburg received the Nobel Prize because when you have a deficiency of 35% or more of oxygen, you can go into what they call a cancerous state, which I'll just say it's stage 4 inflammation. When you've got kidney stones, you're in the same problem. So understand that when you've got calcium stones or deposits in your breast or anywhere else in your body, then you are on fire mentally and physically. Okay, here we go. All right. I'm going to keep doing these trainings for people that want them. And those who don't, well, they just don't. But I am going to prove to you that I will make you smarter than most of the practitioners out there. And smarter means logic. I didn't say that I'm going to give you more information. I said I'm going to give you logic. If you've got logic, you don't need all this information that practitioners are running around with that are just confusing them anyways. Okay, here we go. Oh, wait, I have to get this queued up. 1 second. Bear with me, everyone. I'm my own studio now. 1 second. Don't you just love this? Here we go. Give me 1 second. I just have to retune this up. Bear with me. Okay, let me see here.
What is my back condition today?
Okay, here we go. We're going to get started here. Bear with me.
Okay, we're ready.
Okay.
Okay, what is my back condition today?
You have severe stenosis between L4 and L5.
Okay, so she has severe stenosis between L4 and L5. Does anybody know where the majority of all surgeries take place? Oh, let me think. L4 and L5. Oh, does anybody know where the transverse colon is of the large intestine when it falls down? Right in front of L4 and L5. Does anybody understand, and does everybody understand that she's pooping in her pelvis? How else could she have severe stenosis in between L4 and L5? L4 and L5, okay, are, okay, you've got your sacrum, L1, L2, L3, L4. That stands for lumbar, number 4 and 5. Now, there's a stenosis in there. Do you know what stenosis is? When you've got so much scar tissue and calcium in the actual spine in around L4 and L5 that you can't see the nerve running through. Okay, so you get that? So the nerve is calcified and it's got scar tissue wrapped around it. I hope you're with me on this one.
And the nerves, here's the white stripe is the nerves. You can see they run continuously there, and then right here it completely disappears.
Okay, now he says the white stripe is the nerves, and then they completely disappear, and they disappear because of scar tissue and calcium. Now what he says is that the nerve's dead. Okay. Do you know how many people that I've worked on that they say that the nerve's dead, and within 20 minutes we have the nerve back when we do Wolf non-surgical and cell sonic? Well, I'll give you a money back guarantee. The nerve's not dead, but he's not lying because he was taught that once the nerve gets calcified and it gets scar tissue wrapped around it, it's dead. Well, let me just say this, okay? We've choked off. You have to understand that what travels through a nerve but communication, information, electrical frequency. What happens if we build a wall of calcium and we get a rope and we choke off the nerve with the scar tissue? Well, then there would be no transmission, would there? So it's going to stop the transmission. So when you stop energy, okay, you cannot stop energy in the body. Every bit of swelling, every bit of pain, every bit of stiffness, all inflammation is due to calcification or scar tissue. And did you get that? Yeah. So tell me I'm not onto something. So the reality is you're going to feel pressure because energy wants to move, right? Like emotion, energy in motion. When the energy hits a wall, it's like if this ocean here were to have a 20-foot, okay, would have a 20-foot wave coming and it hit this window, it's going to do damage. If you've got energy trying to move in the body and it's being blocked, it's going to cause pain, swelling, inflammation, okay, and eventually stiffness because of the calcification that's being created from the inflammation. Here we go. So stenosis, he says, the nerve is dead. I'm telling you that it's not dead, it's being suffocated.
And that's where the issue is. This should run continuously all the way up and down. You have no room for the nerves. Essentially, the nerves, it's like somebody's coming in and choking them. They're losing their blood supply and they're dying. And when your foot goes numb,
they're not dying, and your foot goes numb because of lack of communication, okay, and lack of electrical impulse. So understand something. Why is it then when somebody comes in, and remember the SI joints that I told you were on either side, and they're right beside L3, L4, L5, that's where your SI joints are. And what happens is the sciatic nerve comes out of the spine, comes around the sciatic joint, and then goes under the buttocks to feed down the leg. And when you get crystallization and scar tissue wrapped around that SI joint, it cuts it off. So at the beginning of it, you're going to get pain coming down because it's not completely choked. When it becomes completely choked by the calcification and scar tissue formation, now you're going to have no feeling in your hip or coming down your leg. Bear with me.
like you said, it's gone numb. That means that you've got a permanent now deficit in that foot because the length of time that it's been choked, that portion of the nerve is dead.
It's not dead. And so guess what? If you're a medical doctor or you're a natural health practitioner and you're going, I never heard this before, he doesn't know what he's talking about. This is where I start getting bashed by people. It's really cool. But the reality is this. Okay, that same practitioner that's saying this right now, do you offer a money back guarantee? And do you think I do this? I'm the guy. I don't even have a clinic right now. If you want to come and get Wolf non-surgical from me or Dr. Sage Wolf, my son, do you know what you have to do? You have to follow us. Like we're going to be going to Stewart, Florida. I'm going to Calgary to do some lectures here on Monday, and I'll be there for 5 days. You'd have to come and get in touch with me. We can do consultations on you there. We can work while we're there on you, but we don't have a clinic right now. I shut the clinic down to help all my practitioners around the world so that they can perfect this. So understand, I'm sending people to my practitioners. I'm not getting any money for this, guys. I want to build up all my practitioners because I owe them. I owe them. Because I'm going to tell you something. Natural health practitioners do not believe in themselves because they've been knocked down for so long. And the reality is I know how to build a natural health business. And I have people coming to us, okay, and not by tens, by the hundreds, who said, I've always wanted to be a practitioner. I thought it was going to cost too much money. I thought I could never do it. I thought it was too stupid to do it. No, you're not. There's a genius in everyone. And I'm taking and tearing that paradigm down. And that's what we're doing. And that's why we shut our clinic for the next 10 months is we're going around and we're going to support all our practitioners to show them we will help them build their business because it's about teamwork and it is about family. All right, so let's keep moving.
The cells are dead, and that's highly unlikely to come back. If you want to make sure that that doesn't happen to the rest of your symptoms and worse, that's why we recommend surgery to decompress the nerves.
Okay, so decompressing the nerves means that we are actually going to go in and kill the nerve. Now we're really going to cut that nerve up. We're going to cut that nerve. We're going to make sure that you don't feel a thing. But remember something, isn't this it? Okay, let me just say this. I can't take it anymore. I just can't take it. My life, I just can't live like this. So I'm either going to turn to pot, alcohol, or I'm going to go take enough prescription drugs to numb myself out. So the reality is I get it. You know, if there's no alternative, and understand, I don't expect people to want to come to us. Why would you want to take massive personal action and believe that the creator of everything gave you a body, that if you created a problem, that when you become conscious, you could actually turn it around? And understand something. Why would people believe me? You know, the reality is why would you want to believe me? You probably never heard about some of this stuff before, so I'm just another crackpot. So I'm just going to keep on talking, and the 1% of the 1% are going to get it and go, well, what do I got to lose? Do I want to go under the knife? Because we know that, guess what? Surgery causes more scar tissue than anything else. So you may not have the pain after they're done with the surgery, but you're not going to have any feeling either. So understand that you're going to be more numbed out. And welcome to a zombie nation where people are looking to numb out their emotions because they don't know how to process properly, because they have created so much fear out there, and you don't understand. You're not supposed to react and attack. When they're doing all blah, 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 it's the end of the world. I'm bored. No, just leave. Don't listen to these people anymore. And understand something. God created your body. You created a problem on an unconscious level. Just think if you became conscious and you said, I'm going to become my own practitioner. I'm going to take massive personal action. I don't really know hardly of anything that you couldn't turn around. But guess what? When you don't believe in yourself and you've lost your faith, I get it. Here we go.
Allow them to have a normal blood supply again by having normal space. And in addition,
Okay, now he's saying if you get the surgery, you'll have a normal blood supply. No, you're not going to. It creates more scar tissue than anything else. All he can tell her is that, guess what? You'll probably feel no pain. A lot of people after surgery, they don't have pain, but they have stiffness. They don't have the flexibility. They don't have the mobility. They don't go back out and play the sports. They're not active anymore. Maybe they don't have the pain, but they're not active anymore. And I want you can have it all. If you believe in yourself, you can have it all. And understand, I'm not telling you not to go get surgery, but the reality is if it's not a 911 emergency where you have to have the surgery because it's a life and death situation, then why are you doing it? Why are you doing it? Why don't you give love a chance? Oh, that would be self-love. Why don't you give self-care a chance? Well, because I don't understand it. Well, I want to do something with you right now. I want to challenge you. You go to my library and take a look at Reverse the Irreversible at docofdetox.com, and go look at how to become number one at the art of number two. Go and do that. And then if you think that I know something, then why don't you go and listen to The Highway of Health? Okay, that's all about your digestive tract from your mouth to your rectum. Why don't you learn the truth about that for the first time? Really, I lay it all out for you. And then go watch one more. Okay, holy crap, the Holy Grail, your large intestine. You go and do those things for me, and then you come on and then challenge me, and come on and we'll do a live. Come and challenge me. Okay, because when you challenge me, you're actually also challenging yourself. And the day that I say that I want everyone to believe me the first time they hear me, I would be a fool, because I know that I'm totally different. I know that I'm not in the same thing. But reality is if you don't want to become a statistic, then you've got to break away from this. How to heal IBS. Well, that's irritable bowel syndrome. You wouldn't have irritable bowel syndrome. Please don't bring your questions on yet. I'm almost ready for them. I had RNY surgery. Okay. You wouldn't have irritable bowel syndrome if, it's not what comes out, it's what stays in, Susan. It's what stays in. So whether you want to believe it or not, you can tell me you have 3 bowel movements a day, but it's what stays in. And when it stays in there, it putrefies. The older the fecal matter, the more putrefying it is. It creates what's called endotoxin. The endotoxin eats on the lining of the large intestine inside, and that's why it's irritable. How would you like to have, you do know your bad bacteria are farting what we call endotoxin. And that endotoxin, if I were to, it would irritate your eyes, for God's sake. So it's irritating the inside lining. And remember, the inside lining of your large intestine is only 1 cell thick. So you keep on burning that out, you'll create a scar tissue issue and leaky gut. Because what will happen is the yeast inside of you will turn into a fungus. They'll become drill bit predators, and they'll drill holes right through your large intestine. Now you're a screen door in a submarine. How cool is that? Here we go.
In addition to that, because the reason why the nerves in your case are getting squeezed like this is because of something called a spondylolisthesis, where the arthritis has caused the bone to slip. We have to put in.
Okay, I'm not buying it. I'm not buying it. See, he's using all these big words. You see how he had to take a second, spondylolisthesis, right? It's a heck of a word. She doesn't know what that is. And then guess what? What does arthritis mean? Arthritis just means inflammation of the joint. Look it up. Tell me I'm wrong. And then guess what? If you don't look after inflammation of the joint, which is caused from infection, then guess what you get? Then you get what? Rheumatoid arthritis, which is just inflammation of the joint that hasn't been treated properly. when it was arthritis. Now it's rheumatoid arthritis. And then guess what? Then you're going to get osteorheumatoid arthritis, which means now the joint is all calcified from pulling the calcium out of the bones. And now you're getting into a really big problem. There you go. So yeah, I call BS. And I'm not telling you that he's lying. He's not a liar. He has been trained to talk like this, to think like this, just as I trained myself. I didn't let anybody else train me. I went to school, but I schooled myself. And you need to learn to school yourself. You need to go in and you need to get rid of belief systems that are stopping you from growing. All I want you to do is bring in prominent, dominant belief systems into your mind that say, I totally love myself. I'm going to care for myself. I'm going to respect myself. I don't need you to like me, love me. You need to love yourself enough that you're going to stay in the conscious moment and own it and know that everybody out there, they want to help you. But what if a lot of people have been given the wrong information?
And screws to bring the bones back into place.
Okay. So now what they're going to do is they're going to use screws to bring the bones back into place. And I'm going to tell you something. Do you know how many times we've had patients like this and the body will totally heal itself? We get no credit. All we do is give the information to help to stop the infection that goes to the inflammation, the scar tissue formation, and the calcification of that area. We do non-surgical to pull the fibers apart because of the inflammation. Everything is beef jerky and it's stuck. The fibers are stuck together like glue. So we got to pull them apart. We got to get the blood flow in, the lymph flow, and the energy flow called their spirit to flow through the area. Let me tell you something. If I'm out here and I'm trying to make a call in here, when I was in Mexico, the walls were 10-inch thick of cement. Unless somebody was standing in front of a window, we could not get a call into the offices. Did you get that? Now, the reality is, if you are pulling calcium out of your bones, you're creating cement walls. Do you think that the nerve would be able to send all those frequencies, vibrations, and information and communication through? No, it's going to get stopped. So anyways, he wants to put screws in it. Okay, so he wants to drill holes the size of my finger. I think he says 6 of them. And he said, that's nothing. That's nothing. And then he wants to put screws in and to try to pull the bones back. Well, what if we were to get aligned emotionally and physically with our lifestyle? Guess what? Your whole body would get aligned. Yes, we do have to go in and do non-surgical. Some cell sonic teach you about different exercises to help to align. But guess what? Wouldn't it be great to know that you healed yourself? Seriously?
Into place, and we have to put a little spacer that sits in between there to allow the bones to fuse together.
Okay, so now they're going to get rid of the disc that I told you were thinning out, and they're going to put in plastic spacers in between her vertebrae and then screw them in. Can't wait. Can't wait. You know what? I'm ready to be challenged on this. You can only have 10% of the cartilage left and it'll grow back. What? Really? I've never heard of that before. Well, it doesn't matter that you didn't hear about it. You know, just because you heard about something one time doesn't make it a lie. And just because you heard about something a million times doesn't make it the truth. I want you to think about that.
That's the solution.
Doing that, will this go away?
The numbness? No, that's permanent.
So even after I understood that,
Yeah.
but I was asking if I had the procedure.
So he just told her that this numbness will be permanent. And I don't ever want to say this surgeon's name or the patient, and I don't want to make or humiliate anyone, but you bring me a person that the doctor says that it's permanent numbness, and I will work on you one time. And if we can't bring feeling back into that area, don't pay me. I'm not going to injure you. I'm not going to hurt you. Either are the other Wolf non-surgical therapists around the world and those that have cell sonics they're not going to injure you. There's nothing that we do that will harm you. Now, your tissue could go light purple, dark purple, black, and that's only because you have so much poison in you. You know, guys, you don't understand. that when you bruise and you don't bang into something, you're rotten to the core. That's all. That's how much infection and inflammation you have in your body. You know, I teach people how to use our clapper and start clapping any area that might have inflammation, stiffness, pain, because you got to bring the circulation back. You don't have inflammation because you have circulation. You have inflammation because you have blocks. That's what the problem is. I'm going to tell you something. We are going to bring the thunder down all around this world. And I am going to keep on doing what I'm doing. So you have to ask yourself, and you can say, why is he coming on all the time? Well, just know this, that you don't have to purchase anything from me, but I'll make a promise to you that over the next 10 months while I'm traveling around the world, if you listen to what I'm doing, I promise I will teach you more about health. Don't spend a penny with me. And I'll teach you more about health than you've ever been taught before, because you know what? It would be in my honor to do it. Okay? It would be my honor to do it. I'm not up to anything except this. How does it feel when you help somebody have a beautiful day and put a smile on somebody's face, or you can see that now they're not in the emotional or the physical pain? What if that's all I wanted to do? So go ahead, try to see what I'm really up to. Okay? What is he really up to? I'll tell you what I'm up to. I'm up to creating a Braveheart nation of people that say, we don't even need you, Dr. Wolf. Thanks for all the information. I got this. I'm going to now. So now I'm going to heal myself and my family. That's what you're going to say. And that's what you're going to do. I'm going to tell you something. Do you know how many medical people and how many natural health practitioners have poverty consciousness? I don't have that. You know, at one time, I thought I could never make enough money. And even when I'd make a lot of money, I'd pretend I didn't. Boy, was I messed up. I know you don't know me, but you'll find out what I want to do and the reason why I'm doing this in short time. Okay? All right, let's keep going.
Changes then, will that?
Probably not.
So it'll never come back for
The parts that'll
circulation.
go that have a chance to get better and that probably will get better are the parts that are not permanent, which are the pain in your back, in the butt, running down the legs. But numbness that is there all the time, that's an indicator of a permanent problem.
Okay.
And
Do you notice every time he's got his pitch down like I do mine, right? Like pooping in your pelvis, issues in your tissues, junk in your joint. And he goes, permanent. Like this is going to be permanent. And he's right. When they do this surgery, she's going to be permanently numbed out. Okay. But the reality is I'm not telling you that they're wrong. I'm telling you that if you're tired of the pain, go get surgery and you will get numbed out. If you don't want to be numbed out and you want to be a high vibrational being, you got to be in touch with your emotions, which means you've got to go in and retrain your brain and put more powerful, more self-care, more self-love beliefs in there. Yeah.
And that, once it happens in one place, it's a matter of time before it starts happening in other places. And you know, that's why we recommend surgery in the first place, is to prevent in the worst.
Okay, so the reality is he's absolutely right. If you are not going to change your bad habits, if you're not going to get some other really good habits like self-care and self-love, if you don't want to go into my website and take a look at the 12 loving steps or do the mirror work or get a Braveheart love band, 3, 2, 1, I got this, that's a kiss, this is as snug as a hug. If you don't want to love yourself, if you've got it, and guess what? You know what? If you don't want to totally unconditionally love yourself, then go get the surgery, because you better numb yourself out, because you've got one hell of a bumpy road coming. You're either going to love and care for yourself, and if you don't and you're a self-loather, you think that you're not smart enough, pretty enough, healthy enough, if you don't think you can pull this off, then get him to go numb you out, because you need to get some kind of peace. I get it. You know, people that are in pain all the time, no wonder they think about suicide. And the reality is you're only in pain because you're out of alignment on an emotional level before a physical level. Let's go again.
Worst case scenario, let's say you got surgery done and nothing got better.
Nothing gets better.
The worst case
after the
scenario
surgery.
stops the problem from getting worse. obviously the
Okay, so this is the deal. When you go to surgery, worst case scenario, okay, nothing's going to get better, but guess what? It's not going to get worse. Yes, it is. He's wrong, because surgery causes more scar tissue than anything else. So understand, if I've got a beaver dam in the middle of a river, and when things are coming down the river, does the beaver dam get bigger and more blocked? When's the last time that you had a stiffness problem and it got better? It felt like it went away, but why is it that you're always re-injuring it? Well, because it's scar tissue. Scar tissue is not flexible. It's not elastic. It doesn't have blood flow. It doesn't have lymph flow. Okay, so it's going to tear out. Beef jerky. That's what you're becoming. Look at. Do you know why at 96 I'll have the flexibility of a 26-year-old? And I'm telling you, I will, because I know how to go into my issues in my tissues and my joints and get rid of the calcification, crystallization. I know how to pull the scar tissue apart and get the blood flow back. Hey, listen, let me ask you a question. If I've got 100% blood flow in a certain area of my body, should I have 100% health? So did you ever notice that when you have an injury, you've lost circulation? That's what it's all about. Let me tell you something. Nobody does it better than us. We know how to pull the scar tissue apart. We know how to get the calcium back into your bones. We have what's called a cell sonic that will stop, okay, and end stage 4 inflammation, just like that. Now, will it stay away? Probably not, because guess what? Your beliefs create everything. Unless you change your beliefs, you change your habits, you change the way you eat, think, and drink. And then the reality is this. We also have a device called a cardio med bed that we could have somebody come in and they could have a 90% blockage in their heart. After 35 hours on a cardio med bed, they would have a whole new set of arteries that would be created due to the actual contraction and the pulsation of this cardio med bed. I'm not making this up, but remember something. If you became a high frequency being and all of the frequencies were traveling throughout your body properly and you had perfect circulation, then why would you be sick?
High majority of people are going to notice significant improvement in a lot of their symptoms.
In my situation, there would be significant improvement.
I would expect that to be the case.
We expect it.
And would that be the minimal surgery where you go in with the incision, or you have to break me open?
It's a minimally invasive procedure. We make a few little openings about the size of my thumbnail, and do all the screw.
Okay, wait a minute here. Okay, so he's going to do like 6 openings the size of his thumbnail, and that's minimal. Well, I guess it would be if you're a surgeon, because these guys have gone all the way. So that would be minimal, but for me, that would be maximal. I don't want anybody doing that, because I know that surgery creates more inflammation and scar tissue formation. You got to understand something, everyone. I just want you to get this. When you're all done treating your body, okay, like a used car, okay, just know this, that you've got 50 trillion cells, okay? 50 trillion cells, okay? And those cells have a heart, they have a brain, they have a nervous system. And when that knife goes in there, those cells freak right out. And then the adrenaline and the cortisol rushes into that area. And that's what causes the crystallization and the scar tissue formation. And because your body loves you so much, if you decide to get surgery, you make sure you go see a Wolf non-surgical therapist. I'll give you a money back guarantee. So guess what? So I got all these therapists out there. And if they call me up and say, Dr. Wolf, I had to give the money back to this person, I give the money back to them. I know what our stuff is and I know how good it is. Here's the deal. Your body loves you so much, it's going to send tons of fibrin into the area. And the more traumatic the surgery is, the more inflammation, the more stressed out you are, the more fibrin and more adrenaline goes into the more adrenaline that goes in, the more the cortisol goes in, the more fibrin that goes to the area, because it's traumatized. So the more fibrin that goes, hey, guess what? Do you have any pain? No, I don't have any pain, but you know what? I feel stiff. And if I try to extend it or flex it, it feels like it's going to tear out. That's right. So I'm not telling you never to go get surgery. It's your body. It's your life. We will never tell you to do anything. I'm just talking what I would do. But the reality is after every surgery, you need to go and get that scar tissue pulled apart so the blood supply can come back in. And now you got flexibility back. Wouldn't it be nice to have the flexibility? When they tell you that the surgery will not allow you to have range of motion, I'm calling BS on that one, because they don't know what we know. They don't know what we know. We are the new kids on the block, okay? And that's because, guess what? This whole scar tissue calcification issue has been buried, because if people were to find out about this, that would dismantle the whole medical platform.
Same
You're
day?
gonna clean out, no, you have to spend the night. You go home
The
the
one
next
night?
day. Yeah. For the majority of patients, they go home. About 93% of patients that we do go home within 23 hours. So they spend an overnight and go home the next day.
So doing that won't release whatever it is, and
I mean, it's possible, but
I'm really disturbed to hear this, so you know.
yeah, listen,
It's very disturbing.
I think when we saw you last time, I think we talked about the fact that
Yeah,
these things can
And you
become
know, yes, and I'm aware of that, and you know how it is when you're just concerned about, God forbid, it being worse and a chance and all that, and I was doing everything.
Okay, I'm not going to play the rest because they get into a little bit of a skirmish. Okay, all right, because she doesn't like what she's hearing. All right, so we're just going to leave the rest for now. Okay, so now I'm on a couple platforms here that I can take messages if anybody has any. Okay, can a messaging percussor help if you can get, well, the percussor is going to help a little bit, but no, you have to understand something. If I had a percussor hitting this, that's going to loosen it up some, but it's actually the Wolf non-surgical technique that finds the cracks in here. See, what we got to do is we got to untie the knot, right? Because that's what you said. I have a knot here, or I have a knot in my low back, okay? Or I feel like I have a knot in my knee. You have a knot somewhere, so we have to untie the knot, and then we got to open up the fibers, and bam, we're right back where we started. It's all a big racket. They would rather keep you sick, but they don't care if you die. And understand something. This is not about the medical doctors. You need to understand, go watch Medical Mafia in my library. Let's make sure that we don't target medical doctors. Medical doctors became medical doctors to help. I swear to God. I have so many medical doctor friends that have saved lives through their surgery. And okay, they know that they're caught up in a system. But the reality is that these are good people. And the reality is they're caught up in a system that's corrupt. They are not corrupt. My son can't breathe, though, through his nose, deviated septum. What can I do? I don't know where you live, but this deviated septum thing, I'm going to tell you something right now. If I had your son here, so understand, everybody, I don't mind you challenging me. Okay, challenge me. Go to braveheartnation.com. Take a look at my schedule. I'm doing free lectures all over the world. If you can't make it to the lecture, just give me a call and say, hey, while you're training in Stewart, while you're training in Texas, while you're training in Barrie, Ontario, while you're training in Calgary, Croatia, England, Australia, or wherever we're going on our whole tour, I'll show you. His deviated septum would take me, are you ready for this? It would take me 5 to 10 minutes and to reverse it. Now, I'm going to tell you that it's the truth. So what happens is the swelling on a continual basis creates scar tissue. The scar tissue, it gets bigger and bigger. What if I were to open up the scar tissue and allow the blood flow? Guess what? Everybody says, Dr. Wolf, when you work on me, look at all this scar tissue, this fibroid, this tumor, this scar tissue I have. Where does it go? It doesn't go anywhere. When you let the life force of God in, and I'm telling you, the blood supply, the lymph, and your spirit energy, guess what? Scar tissue is invisible, because you are not trying to get rid of scar tissue. You're trying to bring the life force back into tissues that have shut down due to infection, then inflammation. I hope you're getting this. I can prove this, even though I might sound crazy. Okay. What are your thoughts on full body vibration machines? Those ones that you stand on, I think they're amazing, and they're great. And guess what? What I would do if you can't afford a brand new one is go on Marketplace on Facebook, or go on Craigslist, because people will buy them and use them as coat racks. But get one with 2 motors in it, and understand something. Use it, because you want to move your lymph, you want to move your body, and we just don't exercise enough. I think they're amazing. We have one in our office and we want to have one at our home. I don't know why it's freezing up a lot. Here, let me see. Herniated, no surgery, but 20 years later. I can't see. I'm gonna have to move this. 1 second. Just so I can see. Okay, 1 sec. Okay, 5 hernia. Okay. 1 sec. 5 cervical herniated discs. Herniated disc is just inflammation, guys. Sorry. And then the inflammation turns into scar tissue. That's easy to reverse. No scar tissue. 20 years later, my vertebrae are now eroding. What's next? Okay, first of all, let me just say this. What's your name? RWEBER, whatever that means. I just want you to know this. If you want to come by, we'll do a live. I won't charge you. I will take 5 to 10 minutes and work on your cervical area, and you're going to go, oh my God, I can't believe what's happening. And then guess what? If you got on calcium ion therapy, they won't let us sell it on our store. Understand, it's non-toxic, guys. The FDA stopped us from selling calcium ion therapy because it's the only calcium product that works. It'll grab all the calcium that's been displaced from your bones and bring it back into your bones, and it will heal your bones. If you don't believe me, go to docofdetox.com, go into my library and look at calcium ion therapy. We have a video on every autoimmune disease with calcium ion therapy. We have more science that can choke a horse. We have not thousands, but tens of thousands of testimonials. Okay? And understand, this is calcium ions. Calcium ions are the only calcium real therapy. Calcium supplementation is no good. It causes the problems you think you're trying to get rid of. And this goes right into the cells to decalcify the mitochondria that make the ATP, that create the energy, to create the healing, to pull the calcium back into the bones. It's all about science. It's not about BS. It's all about science. Okay? Let's see. Do we have anything else? Because if we don't have questions, I'm going to be moving on. Where are you located? Okay, well, we have what was called the NWP World Healing and Training Center. The next place that will be opening, we're not sure. It's a toss-up, either Mexico or maybe Puerto Rico. Okay, and the next center we open will be a 5-diamond clinic. It means that when people come there, they're going to be coming not for treatment. They're going to be mainly coming for training and treatment. Dr. Wolf, I have tinnitus bad. Went to your web, slaphead, etc. I'll pay anything. Okay. Listen to me, Phil, here's the deal. So if we were able to do non-surgical and also sell sonic, you can go on my website to take a look what cell sonic treatment is. It's the most powerful energy medicine device in the world. 25,000 volts put into a field harmonic, because nobody could take 25,000 volts. But it will go in and shut down inflammation even at a stage 4 situation. And the reality is this. When you have tinnitus, there's a little nerve that goes from the inner ear all the way up to the brain, and you've inflamed that. You've inflamed it through, I would tell you, listen, everybody, get yourself a perfect day consultation. It's $150. You're going to get my perfect day guide, which is almost a 400-page manual, and it is the best health book in the world. It's going to guide you. It's going to show you why you got where you got to. We explain it all. But when you get a perfect day consult for $150, you'll get 6 weeks of unprecedented support. I mean, you can call as often as you want. And then you can work with any of our master trainers for the rest of your life for free. I said, you did hear me say for free. And then people will come on and go, what's his scam? He's up to something. Well, I'll tell you what I'm up to. I've been at this for 40 years. And if we don't provide support, okay, if we don't provide support to our patients and clients like this, they fall off. Why? Because people are learning a new language called health, and it's actually self-care and self-love. That doesn't happen in an hour consult. It doesn't happen. It takes 9 months. If you were to learn the 12 loving steps, like the mirror work, the love band, connecting to your lion heart breath, keeping a slight smile on, doing the perfect day diet, doing the crab stretch, the pelvic squats, ultimate coffee enema, advanced water fasting, we've got all the techniques that we have gotten from people all over the world that work. And as far as clapping goes, you're going to need to clap. If you were to clap that tinnitus, for like in front, underneath your TMJ, behind, really behind a lot, and above. I want you to do it. If it's only the 1 year, I want you to do it for half an hour every night. It's going to feel like it's ringing even more. Guys, all you got to do is go to braveheartnation.com. You've got my whole itinerary, and understand, when I finish here, if you call me at 469-861-9454 and you don't get me, leave a message, I'm going to call you back. I'm not hiding out here. You need to get that. Okay, so what you're going to do is you're going to clap that area, and then what you're going to do is you're going to put yourself, lay on your side, and then you're going to put like a little pool of infinite iodine. We have the only pure iodine in the world. Nascent iodine is not pure, either is Lugos. You could never blow your thyroid or ever have a problem with our iodine, but you're going to put a little pool of it in your ear, let it soak for 3 to 5 minutes. Then what you're going to do after that, okay, you're going to then put in what's called Bright Eyes Fulvic drops. You're going to drop in just 4 drops, and then you're going to squirt a little bit of silver bullet gel into the ear, and then you're going to put a hot pack on there, and you're going to do that in the morning and at night. And then you're going to do your clapping. And if you can get to a Wolf non-surgical therapist, get them to work this area. They might have to work it anywhere from 3 to 5 times because it's so calcified and so much scar tissue. But you got to do the soaks. Okay. Understand, tinnitus will drive you crazy. Yeah, Jason. Hi, Jason. Jason is our host in Calgary along with Alicia. Alicia, there's a lecture next Wednesday and Thursday in Calgary. And the training, we have a full whole life coach. If you want to know how to become a certified coach in emotional nutritional therapies, it's called Whole Life Coach. That's 9 days. And then we go right into Wolf Non-Surgical, which is a 12-day certified course. And then I also will be doing what's called a Braveheart Circle for the general public. And that's where they come to find their authentic self and learn all these keys. And we have this big circle where we all talk together, and that's a 6-7 day course. Okay. And then we also have the 3-day pelvic course, and that's at the end for women on how to heal your pelvis. You can take a look at this all on the website, guys, but we'll be doing lots of lectures every week that I'm there. No matter where I am, we'll be doing a lecture. So I've got a lecture before the courses start, and then one every week, and it's for free. And we do want to take donations because we're going to be taking donations for local charities. Okay. Dr. Wolf, oh, the tinnitus guy. Okay. So you need to do that for the tinnitus. And somebody was asking here about gum disease. I'll tell you what I do, and you can do what you want. I've got what's called silver bullet gel. I'll squirt the gel onto my toothbrush. Guys, my gums used to bleed no matter how good my diet was, you know, and I always, and no, they wouldn't bleed much, just a teeny bit. And now maybe it was stress or what it was, but now I take silver bullet gel and I squirt just a little bit of silver bullet gel on my toothbrush. Then I put a couple drops of what's called Healthy Mouth essential oil. And then I put a little sprinkle of black gold. You do that and you'll have no plaque. You do that, you'll have no gum disease, you'll have no bleeding. It's the most amazing thing, okay? Is there a way to heal basal cell carcinoma on the nose? Which product? Okay. I would actually use a Cellsonic if, Susan, I don't know if you live near somebody who has that. You can always call and check. But you can use a Cellsonic on that area. But what you're going to put on the nose, okay, is this. I would mix, okay, just a little bit, a couple of drops of frankincense, okay? Our frankincense is a lot stronger than frankincense. But even 1 drop of frankincense, it's the most strongest frankincense, and I would mix that with a little bit of C60, and I would put that on the nose, and take a look at MCT oil C60, 250 times stronger than vitamin C. 253 or 300 times. Everybody says different. And I would put that on your nose, and that's going to help take that away. Now, understand, it could have been you burnt your nose in the sun before, but nobody gets skin cancer unless they're toxic internally. You have to understand, when you go out into the sun, you sweat, yes or no? Well, I go out into the sun, I could burn myself. Yes, there'd be radiation in here, but I know how to get rid of that by clapping or by using silver bullet gel. Okay, if I had a sunburn, I would use silver bullet gel right away until it's gone to help to pull that out. And then I would clap the area of the burn to get the radiation out. and I'd clap it with one of our clappers. You can see it on our website under body care. But where was I? A friend has it on her nose. They planned surgery in June. Well, you know what? I'm going to tell you that if they want to give me a call, they can. I would change it up. I would use a little bit of silver bullet gel and C60. I would use a little bit of C60 and frankincense, and I would just keep putting it on the area. And at nighttime, I would soak a little bit of natural cotton, and I would soak it with this, and then I would put a Band-Aid so it just stays there and it soaks on it. It's probably going to fall off, okay? But understand something. The health of your skin is showing the health of your large intestine. I'm not kidding. So understand, your large intestine is the holy grail of your immune system. So guess what? If you've got a swollen belly, or you've got a fat tummy, or you're hanging down over your belt, you're in big trouble. Okay, Dr. Wolf. Okay, no, let me see here. My uncle is on dialysis. Oh boy. I'm going to try to find it. Where did you say to look up the doctors about our health to learn about what doctors do? Yeah, it's called Medical Mafia, and it's in my library at docofdetox.com. And if you're asking about our schedule and all our trainings and our lectures, you go to braveheartnation.com. My uncle is on dialysis. He is a diabetic. How can I help him? He means the world to me. Yeah, that's great. He means the world to you. But usually what happens is that you want him healthier than he does. That's a big problem. You know, we've all tried to help people and try to talk people into getting well. Oh my God, why don't they get this? What's wrong with them? Are they so stupid? No, they're fearful. And also they're addicted. We're addicted to our lifestyle. So you know what? It's like this, healthy beliefs will keep you healthy. Unhealthy beliefs will keep you unhealthy. And your most prominent dominant beliefs run your life. That's it. You know, I'm going to tell you something. You can believe this or not. Most people are never going to make it. If they were to come to a Braveheart Circle, I'm serious, a 7-day Braveheart Circle, you got to go in for boot camp, emotional, in-depth training. That's what it's all about. It's about reprogramming yourself for health. That's it. And I'll tell you something. You come and take my whole life coach certification, you'll never look back. You'll never look back. Okay. Let me see here. So I would tell him right off the bat, he can get on super cinnamon, essential oil, put a couple drops in every liter. That will help him curb his appetite for sugar. Do you understand? Because understand this, there's no sugar in super cinnamon, and it tastes good, and it'll curb his appetite. Next thing is you got to get his bowels moving, and you got to get him on structured water, warm to hot water. He needs to get on a perfect day diet. You know, if you take a look at any diabetic, take a look at what they eat, because guess what? When you become a diabetic and you can use insulin, guess what? That's your highway to hell, because now you can pump in all that refined carbs and processed foods and sugars, and I just have to shoot up to get it all into the cells. I'm telling you, it's not good. Diabetics are one of the most unhealthiest, and if you don't believe me, 85% of the population is pre-diabetic right now. So you can see where we're going. So guys, I don't want to cause trauma, and use fear to sell anything, but understand something. We are on the 6th extinction, and nobody has to do anything anymore. It's our personalities are killing us. Our personalities are killing us. All right, if there's any questions, bring them up, because I'm going to sign off if not. Okay, I guess I'll sign off. You know what? I'm going to be back on here. Her name is Kimberly, and I'll be back on here in 20 minutes because she'd like to come on and tell her story. Kimberly is a practitioner out of Bonita. I will be bringing my practitioners on. They will tell their own stories. And I've got other things planned. Every day I'm going to be doing something like this for you. I told everybody I was going to show you how to do the clapping. I will get to that. Okay. I will get to that. Right now we are revamping everything. Our new app's coming out in 6 weeks. It's been postponed because I just rewrote the Perfect Day Manual, which will be sold on Amazon for everyone who gets a Perfect Day consultation, they will be able to get a hard cover of the Perfect Day manual. Anybody who gets a Perfect Day consultation for $150 gets the PDF free, and they get 6 weeks of unlimited support with that trainer who started with them, and you'll have unlimited calling with me and my staff forever. Listen, if you don't know how to look after yourself from the moment you rise until you close your eyes, then you are going to get yourself into trouble. Okay? And understand something. Don't make me responsible. Don't make anybody responsible for your health, because your health is your wealth. Okay? God bless everyone. And like I said, go to braveheartnation.com if you want to check out our world tour and our trainings and lectures. Go to docofdetox.com and go into my library. I have the biggest self-help, self-love, self-care library in the world. It's for free. Okay? All right? It's for free. God bless. I'm going to see if I... Watch. Hi, can I help you?
Is this Dr. Wolf?
Yes, this is Dr. Wolf. How are you? I'm just on a live right now. Don't go anywhere. I'm just going to shut down on the live, and then I'm going to answer your questions. Okay, love?
Thank you.
Okay, 1 second.
Go ahead.
Okay, this is the part I love. Trying to do this. Okay. Okay.